Well, the government's expert panel was chaired by Dr. Eric Hoskins, the former health minister in the province of Ontario. He's with me now. It's good to see you.
Good to see
Thanks
you.
for coming to talk about this important report out today, the final report with your recommendations. Let's start with the big one and how you and your colleagues on the expert panel decided that a single-payer, universal, publicly funded pharmacare plan is what this country needs now.
Well, as you know, we spent a year consulting with Canadians, crisscrossing the country, talking to a lot of patients, healthcare providers, people in the industry, and we've come to the conclusion that the best thing for Canada in a Canadian context to improve access to medicines and also to control the rising costs is what's known as a universal single-payer public model.
What's not working now?
Well, what we're finding is that the price of medicines are skyrocketing, quite frankly. It's the second largest expenditure in healthcare after hospitals, even more than what we pay doctors, we pay for prescription medicines. And that curve is going up faster and faster year over year. At the same time, Canadians aren't getting the access that they need. We estimate that about 7.5 million Canadians are struggling to pay for the medicines that are prescribed for them.
The finance minister has said to this point that he was looking for a way to at least fill the gaps for people who don't have coverage in this country. Why isn't that the way to go? Because I think that's what a lot of people on the other side say. Look, Canadians have coverage through their workplace or through other publicly funded plans, and it's a smaller percentage of Canadians who don't have any coverage. Let's fix that.
Well, we looked at that. We looked at a fill the gaps model. What we found is, although probably about 5% of Canadians are completely uninsured, about 20% of Canadians struggle to afford their medicines. Many of those are underinsured. Many of those actually have private coverage or public coverage. Mm-hmm. So it isn't as simple to be able to identify who those people are. But also, if you take a fill the gaps approach as opposed to single payer public universal, treating it like Medicare, the other aspects of our healthcare system, if you look at fill the gaps, you don't get the benefit of having a stronger negotiating position with pharmaceutical companies to drive down the cost of medicines. And also, you don't get the benefit of administrative efficiencies as well. And the way I look at it as well, if you look in the 1960s when we brought Medicare in, there were also a lot of people and organizations that were calling for a fill the gaps approach. If we had have followed their advice, we would have an American-style healthcare system in Canada today.
The finance minister said he wants something that's fiscally responsible. Your report pointed out today it'll be $15 billion to create the plan and to cover the costs of drugs, of course, which increase incrementally over the next decade. You want this plan in place by 2027. Is that fiscally responsible?
We believe it is. So in fact, the model that we're putting forward, single payer public, will result in annual savings. Well, the first year of implementation of pharmacare will result in $5 billion of savings. Furthermore, the average Canadian household or family will save approximately $350 per year per household. Employers will save about $750 per employee. So there are both on the sort of national scale as well as at the micro level, if you will, employees, employers, right, and households. There are significant savings to this, and those savings come about because we have everybody coming together to purchase together as one purchaser, and then we have great negotiating strength.
But how do you get people past that? And I think that's what a lot of people are going to be fixed on, right? And even supporters, but certainly critics, are going to say, look, at the sticker shock of $15 billion. Thanks, but no thanks. How do you get people past that?
Well, we're already paying for it, right? So we're paying collectively $34 billion a year for prescription drugs in Canada, and last year. By 2027, we're going to be paying over $50 billion. So what we're hoping to do through this model, what we believe it will do, is we'll actually lower those costs substantially and make it more affordable. It is a big national project, but when governments in the past have prioritized certain things that they believe are important, they have found ways to pay for them. We think that this is fiscally responsible, and we actually believe that absent this kind of transformation, prescription drugs will become unaffordable, and probably provinces and territories, including the private sector, will be unable to provide the medicines that people need.
Let's talk about the provinces and territories. The key ask here of the federal government is obviously to lead the way on this, but the $15 billion incremental cost, let me come back to that for just a moment. If the federal government's not willing to do that, do you believe that dooms the plan? If they're not prepared to put the $15 billion up, does that kill it?
Well, we've asked the federal government to begin those discussions with provinces and territories. Provinces and territories, as you know, have been carrying the costs of delivering their drug programs, their drug plans up till now. We're asking the federal government to come in and pay those incremental costs, those additional costs to expand coverage and make it more affordable. That's what the provinces and territories called for through the Council of Federation last year. The federal government is we believe, in a position where it can make that contribution. But that's also why we phased it in over a number of years, right? And starting with essential medicines in 2022, which represent about 50% of the prescriptions that there are. We're confident that through those negotiations, the provinces and territories will see the benefits, and the federal government indeed will see the benefit of providing better access to Canadians.
So I guess the answer is yes. If the feds don't provide the leadership on this and take the lead and cover those incremental costs, it's hard to see it starting any other way.
Well, I think they've already provided tremendous leadership, right? In the spring budget, where they announced the creation of a $500 million annual fund for expensive drugs for rare diseases. They announced as well the creation of the Canadian Drug Agency that will be that entity that does the negotiations, evaluates the drugs, negotiates with pharma to get the lowest possible prices. This is a big project, but it's critically important because, as I mentioned, the provinces and territories, without exception, told us that they are finding great challenges in just maintaining their existing drug programs. On the private side as well, employers are struggling with being able to afford the drug plans for their employees. And so we need to transform this now, or a few years out from now, it's going to become even more pressing. And it's important to mention as well that 60 years ago, roughly, when 60 years ago, when the calls for pharmacare first began through the Hall Commission in 1964, there have been multiple studies of the Canadian healthcare system since then. Every single one of them has called for national pharmacare.
The timeline, you think it can be done within 10 years?
Yes.
So, okay, and if you hear a political conversation that says we heard from the health minister today, not committing to anything, but saying favors coverage for all Canadians, but not committing to this recommendation. She wants to learn and read more about, which is fair enough. Read the report and find out exactly what you're proposing. If pushing out that timeline or coming up with something short of what you're proposing, is that a failure of leadership? You think we've come to a point now where the bullet has to be, somebody's got to bite the bullet here and make this happen?
Yes, I do. So the government asked us to create an implementation plan for them. So we took into account the objectives that they gave to us: fairness, equity, sustainability, fiscal responsibility as well. We believe that all of those are encompassed in our report. We think an 8-year timeline is a reasonable one. It took us 10 years to get the enhancements to the CPP, for example. For Medicare itself, when it came out, it took 8 years to have full Medicare across this country. So we think it's a reasonable, practical, sustainable, fiscally sustainable timeline. And quite frankly, we can't afford not to do it. That we're in a situation where we're seeing year over year the drug prices that Canadians are incurring, as well as the provinces and territories, 6.5% growth in costs each year. So it hasn't quite reached a crisis point, but I think absent the sort of transformation that we're recommending with Universal, treat it like the rest of the healthcare system, like hospitals, like access to medical doctors and other healthcare professionals. That was what was envisioned in the 1960s when Medicare was being thought about. This requires the same courage, I think, and conviction as those leaders in the 1960s demonstrated, but I think it's definitely possible.
Okay, quickly to finish, we're about to hit an election campaign. What role do you want this to play in that?
Well, I think it's inevitable that it will be a significant part of the election discussion. We know that one major party at least, has put National Pharmacare as one of its key platform planks.
That's the Democrats. The Tories today are essentially rejecting this idea, and we're still waiting on the Liberals. So how do you think it plays out?
Well, I think that will be the interesting part. I think that it's assured that it will be a significant part of the election campaign. I think that's important. It gives Canadians an opportunity to hear from the different political parties, but also for them to get engaged in the discussion as well. I think that's good for democracy. I think the time is right as well. That this is it's exceptionally important if we want to maintain the levels of drug programs that we see across the country and enhance them so that people, 20%, as I mentioned, 7.5 million Canadians they struggle to afford the medicines that they need, let alone individuals or families trying to pay $1 million a year, for example, for a rare disease drug for their child. Like, this is so important right now. Drugs offer so much opportunity. but we need to look at not sort of tweaking the existing system. That won't work. There'll be somebody else like me in 5 years' time that is sort of having to do another report, and like we've seen, many times over the past decades.
All right, Eric Hoskins, good to talk to you. Thanks for coming in.
Thank you.